Good evening, and thank you for joining us for this late edition of Local 5 News. I'm Connie Fellman. Monday, face masks become part of life for most people in Northeast Wisconsin. One local man shares his harrowing tale of coming close to death because of COVID-19 with Local 5's Rhonda Fox. By speaking out now, he wants to show people why wearing a mask is important to him.
I remember asking the doctor, "Don't let me die," and he said, "I can't promise you that." And I knew right there and then how sick I was.
Sean Skinador describes the moment he understood the danger of his COVID-19 infection.
April 8th, I went into the emergency room at St. Vincent's, and they kept sending me home. I had no symptoms, though. I didn't have a cough. I didn't run a fever. I didn't have any of the COVID symptoms. April 18th, they admitted me in the St. Mary's Hospital, and then roughly 3-4 days later, my oxygen was so low that they had to vent me. I mean, it just hit me so hard.
Sean lay in a coma here at St. Mary's for several days and credits the staff with his recovery from COVID-19, but in particular, one doctor.
He was one of our sickest patients, and he was most certainly life-threatening. And he certainly came into this, in a full-blown picture of what ARDS, which is the adult respiratory distress syndrome. His lungs failed essentially, and he required life support for a prolonged period of time. He was on a ventilator for approximately 17 days.
It felt like an elephant was on my chest. I couldn't breathe. I'm gasping for air.
Just a breath away from death, Sean received life-saving plasma from recovered COVID-19 patients.
You collect plasma that hopefully is antibody-rich from patients who had gone through the illness and theoretically have developed some sort of immunity to it. And you passively transfer that immunity to a person who is currently sick.
Sean says no one at his job or at home was or has since been infected with COVID-19, so he can't figure out how he was exposed.
I don't know how I got it. It ain't like you can see it. It ain't like you can taste it. It ain't like I look at you, oh, well, she's got it.
This is now, unfortunately, is in a phase right now where it's in community spread, meaning that most of our patients, frankly, cannot even tell us how they got exposed.
Because most recently infected people are unsure how they acquired COVID-19, doctors say wear a mask.
Each and every one of us has a personal responsibility, yes, to protect themselves, but also to protect others.
In Green Bay, Rhonda Fox, Local 5 News.
Doctors say there has not been a case yet of someone becoming reinfected with COVID-19. As for Sean, he says he has recovered but still has to attend rehabilitation.